The following is a presentation of Sanctuary Medical Care and Consulting.
Hello, I'm Dr. Eric Potter. On today's episode of Know Your Health, I'm going to talk to you about what is MTHFR.
Welcome to Know Your Health, the program that explores the advantages of good health for a full life. Here's the host of Know Your Health, Dr. Eric Potter.
On a regular basis, many of you ask me exactly what MTHFR is. MTHFR stands for Methyltetrahydrofolate Reductase. That's just a big fancy name for an enzyme that processes folate so that we can live. So exactly why is this gene so important now? Well, it's been found to be related to so many different diseases today. From miscarriages, to depression, to cancer, to autism, to chronic fatigue, and fibromyalgia. The list of things are endless. Besides the number of diseases that it's connected to, there's also the fact that it's highly prevalent. That just means that probably 20 to 40% of any given population is going to have at least one, if not two copies of the gene. So what exactly does this MTHFR do? Well, it would take hours to fully explain how much this affects your health. But let's just shorten this down to the fact that it is an enzyme product that changes folate that you eat in your diet into 5-methyltetrahydrofolate, the kind of folate that your body actually uses. Now then your body takes that little 5-MTHF, uses it combined with vitamin B12, which I know you all have heard of, to make methyl groups. So what is a methyl group? Who really cares? Well, it's a carbon with a few little hydrogen atoms attached to it. When you take that and put it on different products in your body, such as DNA or hormones, it makes a big difference. What kind of difference? Well, how about this? It affects which parts of your DNA are actually changed into proteins. So it controls your DNA, controls your genes. How about this as well? Hormones in your body, such as estrogen, testosterone, can be affected by the levels of methylation. If you don't have enough methylation, enough methyl groups going around, those estrogens can be building up in your body or maybe turned into something that's not quite as good for you as you'd hope. Then there's immunity. There are some links that shows that methyl groups are used to turn off virus genes. So if you get a cold virus or other viruses, your body may be using methyl groups to stop it from replicating and causing you more harm. Beyond that, there's neurotransmitters. You may have heard of things like dopamine or serotonin. There's a lot of drugs out there that will change the levels of these chemicals in your brain. Well, methyl groups can also affect your brain chemistry. So too much or too little can cause you to have mood swings, depression, anxiety. Then children are affected by it. Many of you may be familiar with the fact that taking folate during a pregnancy is important to prevent neural tube defects, but it also may impact whether a child develops autism, ADHD, or other developmental problems in children. Complete absence of this enzyme would probably lead to death. However, when you have a variation in this MTHFR gene, it's more like a dimmer switch, not the on and off switch that you have with a light, but the dimmer switch slows things down, speeds things up. When you come back, we're going to talk about how that can affect your health and what you need to do about it.
Dr. Eric Potter has special experience with MTHFR. Sanctuary Medical Care and Consulting offers biblically holistic direct primary care. Direct primary care means convenient office hours and personal house calls for those desiring the best family care by physicians who know you personally. Whether you need a medical professional to investigate your unanswered health concerns, a medical guide to walk with you through the everyday challenges of your personal health situation, or a second opinion of diagnosis, Sanctuary Medical Care provides medical services for your individual needs.
If you would like a personalized plan for the restoration of your health and a doctor who will walk with you through that plan, then contact Sanctuary Medical Care today for your appointment.
Integrative medicine utilizes the divine gifts of both natural remedies and modern technology. A functional medicine approach means that Sanctuary Medical Care aims at the root causes rather than solely superficial symptoms. Allow Sanctuary Medical Care to help you discover what is right for your personal health. Once again, here's the host of Know Your Health, Dr. Eric Potter.
How do you know if MTHFR matters for you? First of all, are you ill? Do you have any of these chronic diseases? Heart disease, depression, anxiety, insomnia, chronic fatigue? Have you had a miscarriage? Have your children had some developmental problems? Well, you may want to get your MTHFR gene checked on. You should also look at your family history. If someone in your family has this condition, you may also be affected by it because you share genes. Why would you want to test for it? Will it make any difference knowing that you have this gene? Well, actually, yes. First of all, many of the drugs we take today, say metformin for diabetes, can actually lower your B12 level. B12 then interacts with MTHFR and may cause you symptoms beyond just the normal symptoms of diabetes. This could be a problem. So what should you do? Well, first of all, I really think that all people should start with a low inflammatory diet, cutting out processed foods and cutting out synthetic folic acid. But beyond that, if you want help with MTHFR, you need to find somebody who understands it. Somebody who can help you navigate the murky waters of MTHFR genetics. So, why not just take a few extra vitamins, say methylfolate and some methyl B12? Why see a doctor at all about this? Well, that would seem like possibly a good idea. However, too much of a good thing can be a bad thing. Taking methylfolate can have side effects: insomnia, irritability, vivid dreams, headaches. If you get too much of it, it may cause problems for you. Besides that, if you don't have MTHFR, why do you want to spend money on supplements that you really don't need? So those are two good reasons why it's good to know and good to have somebody that knows how to care for MTHFR to be caring for you. If you think MTHFR could be an issue for you, give Sanctuary Medical Care a call today and let us help you. Remember to join us for the next episode of Know Your Health. I'm Dr. Eric Potter, Director of Sanctuary Medical Care and Consulting.
There is no better time than now to make better health your priority. Contact Sanctuary Medical Care and Dr. Eric Potter today.